why would you adjust the spine?
Great question. I don't normally call them adjustments because I'm a big nerd and all the research calls them spinal manipulation therapy. So I'm like, it's spinal manipulation therapy. So the way that I understand this is that when you have a spinal joint that doesn't move or doesn't move very well, it causes a bunch of strain on the joints above and below it. And that strain on the joints above and below can cause pain, right? And it causes a mechanical discontinuity that becomes uncomfortable for the person who has it.
Yeah.
What spinal manipulation does is produces a very small amount of force at that joint to make it move. And that does a bunch of things. One, it makes a noise, which is probably not so important. It increases a bunch of cool feel-good chemicals in your brain, so it's relatively pleasurable for most people. It reduces the amount of discomfort from those spinal nerves that moves up to the brain for about half an hour. Sorry, 90 minutes. And the net result of that is we take this area that hasn't been moving well and we induce movement, which gives it an opportunity to move better.
Okay.
So that opportunity to move better can mean that the problem resolves or has a better chance to resolve more quickly.
Okay.
Yeah.
So let's say the problem doesn't resolve. What would you do in that sense?
Oh, sure. Great question. I don't ever just provide spinal manipulation therapy. Very commonly, I'll be doing soft tissue therapy, so a massage type technique, and I'm always giving some form of rehab. For most conditions, these problems will take anywhere between 2 to 6 weeks to resolve, during which time someone will see me anywhere between 1 to 8 times. So the role of the therapy is to provide a window of relief, right? And that window of relief, hopefully we can stack up enough that the person has a pain-free experience while the total amount of dysfunction resolves. And if the thing that we're doing isn't working, well then we talk to the medical doctor, we look at what their lifestyle is like, we figure out if our exercises need to be progressed or regressed. We think about whether or not we have to engage in therapies that are maybe higher dose, but basically the entire process is us paying attention to how someone is responding to care and then doing our best to modulate so that they can get better and feel more comfortable as quickly as possible.
Okay.